I'm Brianna Stanley. I'm the Northwestern Co-op organizer for Citizen Action Wisconsin, and it is currently our statewide week of action to support the investment in healthcare that the governor, Tony Evers, has set forth in the 21-23 budget proposal. So we actually have our Lieutenant Governor Mandela Barnes here, and he's going to give a few opening remarks before we start our roundtable. So I will let you take the floor, Mandela.
Brianna, thank you so much for organizing this event and just the organizing in general that you're doing, because it is critical. I always want to remind people that election day is one thing, but it's the work that we do after the election that matters. So I want to just thank you for continuing to continuing to make sure that communities understand what's going on. And thanks for hosting this event. Thank you all for having me. We know the realities, and I just want to take a moment to tell you all what we are fighting for in this budget. We are fighting for opportunity. We are fighting for the future of this state, because we know that there are far too many children and families here in Wisconsin who have not had the access to quality and affordable healthcare that they deserve. And this is an issue that didn't just pop up in the last year, although the last year has highlighted in so many ways the gross inequities in our society, but healthcare and access to healthcare, and actually the culture of the United States around healthcare in general. And it's up to us to do something about it. And we absolutely can. And that's why I'm proud to be here. And there have been so many people who try to do amazing work around this issue, and I want to thank them for that. And I want to continue to work with people who want to do the right thing. And for me, this has been an issue that I have long supported prior to even being in the state assembly. There was a point in time I had my own healthcare story. Fortunately, it wasn't the sort of life-threatening healthcare story that so many people have, but it was one that put some economic constraints on myself, on my life at the time. My economic ability was severely hindered, as is the case with a lot of people. And I think that, again, the last year has made it undeniably clear the sacrifices that people have made, and also the challenges that people have faced. Nurses, doctors, healthcare professionals, and public health workers made incredible sacrifices to keep us all safe. And we were forced to recognize, or people who didn't realize what was going on, some people confronting this reality for the first time got to see how an untreated medical condition could suddenly become a life or death situation. And also how a surprise medical bill could lead to bankruptcy. And we saw millions of people across this country who lost their health care because they lost their job, which should never be the case. That's the unfortunate reality that we continue to live in. But I am proud of the work that we've been doing since day one, since we took office. Our very first budget, we fought to expand access to quality and affordable healthcare to tens of thousands of people in the state. And also, we made steps to invest in improving the healthcare system for everyone. And now I'm proud that with the 21-23 budget, which is our Badger Bounce Back plan, I should say our Badger Bounce Back agenda at this point, we're building on that work so that we can recover from the pandemic and also make our communities healthier and stronger than they were before we went into this thing. Our plan expands BadgerCare so over 90,000 Wisconsinites who do not have access to the program right now will have access to BadgerCare. And we also are working to create a state-based healthcare exchange so we can catch up to other states in the country, and so that we can also meet the needs of Wisconsinites and invest in affordability. But what's particularly exciting to me, and I know a lot of the co-op members, Citizen Action, is the authorization of the Office of the Commissioner of Insurance and the Department of Health Services to develop a public option for health coverage in our state through BadgerCare. This is particularly exciting because we still have a long way to go as far as universal health care is concerned at the national level. And our agenda also tackles skyrocketing prescription drug costs by controlling costs, increasing transparency, and also increasing oversight and strengthening consumer protections and bolstering programs that are designed to support our state's most vulnerable citizens. And we're also calling on the creation of the Office of Prescription Drug Affordability that will provide oversight on the pharmaceutical supply chain, and also establishing a $50 copay cap on insulin to ensure that it is affordable. We hear too many stories of people who are rationing prescription meds, and insulin being one of them. And also, we want to seek to provide $4 million in increased funding for free and charitable clinics and community health center grants across the state. So these are just a few of the pillars, I should say the three major pillars of our plan to do what we can at the state level, leading by example to make healthcare more affordable and more accessible for everybody in Wisconsin. And we're working to build support from this budget, which is why I'm here today, because we need you to make this a reality. We know how to make the state healthier and stronger. When I say we, I don't mean this administration specifically. I mean we as Wisconsinites, we as people who have been involved in this work, we as people who unfortunately have personal stories to tell or know someone with a personal story to tell. But in order for this to happen, the legislature has to pass this. The legislature has to pass this budget, especially the healthcare provisions. And that's why we need people from all across the state to stand up, continue doing the organizing work that you've already been doing, but hold people accountable who are a little bit iffy on supporting these provisions to make sure that people get the quality care that they deserve. We see too many life or death instances that shouldn't be the case when it comes to healthcare, health insurance, or people who have to use an emergency room as a primary care apparatus. But we know that better is possible. That's why we're all here. I want to thank you for everything that you've been doing. I hate that I have to hop, but again, we can get this done, but it's only going to get done when we all stand up and demand that it happens. So thanks again for having me.
Thank you. All right, have a good night, Mandela. Thank you for joining us.
You too.
All right, so we are going to start off our roundtable, and before we do so, when we go into the questions, so I'm going to do a round of introductions for everybody who's going to be participating in the roundtable, because we have a wide range of people that may or may not all know each other, as well as talk about. If you guys have any questions, you can put it in the Q&A or the chat, and I'm hoping we'll have about 10 minutes at the end. We're going to try to keep this as short as possible because it is 6 p.m. On a Thursday. So we are going to do that. So if you have any questions for Jeff or Jodi or Chris or Kevin, just go ahead and put them in there, and we'll try to answer them at the end. All right, so awesome. So I'm just going to go with who's on my screen first. We have Kevin Rooney, and he is a licensed psychologist here in Eau Claire. So he's going to be talking a lot about, if you want to even give yourself a quick 30-second intro about where in mental health you work and all that, that would be cool.
Hi, thank you. Yeah, I'm a psychologist in Eau Claire. I work at Vantage Point Clinic and Assessment Center, and we have folks here that have connections with the county, and we have clients that use state crisis facilities. Work with a wide range of populations, kids, families, adults, substance use disorders.
Awesome, thank you. And then next we have our state representative, Jodi Emerson. I don't know if you need to say anything about yourself in 30 seconds, but you can.
You're going to cut me off at 30 seconds? No. Thanks so much, Brianna, for doing this. I think it's great. Mandela, Jeff, and I all come from organizing backgrounds, and this is why having these discussions is so important. But for those of you who don't know me, I'm the representative for the 91st Assembly District, which is the majority of the city of Eau Claire.
Thank you. And next we have State Senator Jeff Smith.
Thanks, Brianna, and thanks for asking me to be a part of this important discussion, because there's nothing more important than guaranteeing healthcare for everyone. So I am Jeff Smith. I'm a native of Eau Claire, but I am the state senator for 31st, which it represents all or parts of Eau Claire County, Pepin, Pierce, Dunn, Buffalo, Trempealeau, and Jackson counties too.
Awesome, thank you. And then last but not least is Chris Kapsner, and he is a medical doctor and former candidate for both Assembly and Senate in the state legislature. So hello, Chris.
Hello, hey, great to be here. Great to see everyone. And yes, I'm an emergency physician, and had the great fortune of living here in Western Wisconsin. I live 8 miles north of beautiful Boyceville. and that's where I am tonight. And I'm part of a big group that provides emergency care services in Western Wisconsin, including Baldwin, River Falls, and the Twin Cities. So great to be here.
Awesome. Thank you so much. So yeah, we'll just like get kind of right into it. So the first question that we can each take turns talking about is, what part of the healthcare investment or proposal in the state budget are you most excited about? There is so much in there, from expanding BadgerCare to expanding mental health resources, prescription drug affordability. What part do you think is the most needed, especially here in Northwestern Wisconsin, and that you're the most excited about? We'll start with Kevin.
Thank you. So I've talked with other folks here at the clinic, and there's people that are involved in different things. The one that I'm most excited about is the income disregard for childcare subsidy. I think that shows up with my clients, where parents that are trying to have their mental health needs met, or work, or do other things with kids. It just shows up where they can't come in, or there's other things that it just really puts a difficult obstacle to access, because they're trying to juggle that aspect. That being balanced out a little bit, something I'd be most excited about. Other folks here at the clinic might have different things, but that's the one that I see. I work with kids. So.
Perfect. Thank you. Chris, do you want to go next?
Sure. I'm excited about it all. Anything that's improving healthcare in Wisconsin, it's overdue. Expansion of BadgerCare should have been done long time ago, and people have been hurt because it wasn't done. So as Mandela said, it's going to provide coverage to 90,000 people. And I also love the emphasis on mental health and addiction services. And I just want to pause and remind all of us that if you have a mental health disorder, whether it's depression, anxiety, bipolar, schizophrenia, autism, these are real healthcare issues that are as debilitating, or can be as debilitating, as any medical problem. So we really need to understand that these are fundamental care that every human being here in Wisconsin needs. If you want productive citizens, they need health care. So just the emphasis on healthcare and mental health and addiction services is tremendously positive.
Perfect. Thank you. Jeff, do you want to go?
Well, yeah, I couldn't say it better than Chris about, I'm excited about the whole thing, right? I'm excited about the whole thing. From a legislative standpoint, we could even suggest that drawing the money back into the state of Wisconsin is really huge. It just that alone is a really big deal. But I'm going to just throw in a couple of things that most people might not know much about, and that is that I had a bill last session about surprise billing and ending surprise billing, and I had asked the governor to put that in the budget, and he did. So if you're not familiar with surprise billing, it's one of those, something that a lot of people encounter over time when they thought their insurance covered something, and some out of network person came into the room and did some work, and they didn't even realize it, and then 3 months later you get a bill for sometimes thousands of dollars, and it's this shock, and the insurance company doesn't cover it. And so we don't think that's right, and that's something we're trying to end here. And at the federal level, they're also doing that. Also, what governor is doing is promoting health equity to address disparities, because the disparities in access to healthcare and in health outcomes, particularly communities of color that face systemic racism, is just unacceptable. Pregnancy-related mortality is 5 times higher for Black mothers than it is for white mothers, and that is just a total disgusting embarrassment for the state of Wisconsin. It's been that way for a long time, and it's one of the stark examples of the work that must be done. In addition to initiatives proposed by the governor's previous budget, Governor Evers established the Health Equity Council, which has convened a diverse group of leaders tasked with developing a roadmap to reduce and ultimately eliminate health disparities over the next decade. So I'm really excited about that, on top of all of the things we're hearing tonight, and is in that bill that everybody knows about.
Thank you. And Jodi?
Yeah, there's so much to be excited about in this budget. And just so y'all know, the budget itself is several hundred pages long. So, we could have a 4-hour discussion and I wouldn't even hit my top half of the things that I'm excited about. But just like this federal stimulus package that just went through in Washington is going to make a big difference in people's lives, I think this is the opportunity where we're at right now with our state budget. We have, for the last year, looked at things. Problems have been magnified by COVID, whether it's housing insecurity, whether it's health issues, whether it's problems with our criminal justice system, racial disparities, whatever the issue is. Everything that we've been talking about for the last year has been here. It's just magnified more. And this is our opportunity to really say, now, what are we going to do about it? How are we going to increase support for small businesses? How are we going to increase support for healthcare? And so one of the biggest things that is going to make a huge difference in people's lives is obviously expanding BadgerCare. And I know we're going to talk about that a little bit more as we go on. But this is something that's going to bring in $1 billion in 2 years, $1 billion from the federal government to Wisconsin. It would be so fiscally irresponsible for us to leave that money on the table. And then it saves another $600 million in other costs. So 1.6 billion is what it's going to cost us, or save us really, to accept this program and expand it. And in the meantime, it's going to help more people. This is something that we just really have to do. As Dr. Kapsner said, that, it's way past time to do this. One of the exciting things about being an elected official is we get to sit down and have conversations with the governor and the governor's staff about what we want included in the budget. And I was really excited when he included a proposal of mine to help people who are in mental health crisis. We talk about that a lot in this area. And he included something in the budget for a $1.5 million grant that will help mental health professionals establish relationships and partnerships with law enforcement agencies, so that if somebody is in mental health crisis, they're treated like the health crisis that it is, instead of incarcerating them, instead of fining them, instead of taking them to jail. Let's get them the help that they need. We're seeing that a lot more in our area here in the Chippewa Valley, and it's something that we need to spread around the state. And so that's definitely one of those upstream issues that's going to help people stay out of an even deeper crisis. And that's where we start to make changes in people's lives. So I'm hoping that one sticks in the budget.
Awesome, thank you. And my next question is going to be mostly to Chris and Kevin. And I think Kevin kind of touched on this a little bit in his intro, but what are the specific challenges that you do see faced by your patients and your clients, in even if they're rural or within the city? I know that Chris probably works more with the rural area because he is there. So what are the specific challenges, and what will these budget proposals help with those challenges, and go forth? Yeah, and so whoever wants to start first.
I don't mind going first. The main thing that I notice is access. When we talk about mental health, access to therapy, and depending on the degree of severity of problems with different levels of socioeconomic status. So some have more access than others, and as you get more north, there can be fewer treatment facilities. We have to travel for some treatments, and for example, there might not be treatment for inpatient treatment for adolescents in Eau Claire. We have to travel for those things, and people have to go to the state, across the state. And then inpatient access is another thing that's needed, and then education knowledge about mental health treatment and collaboration for treatment across different programs, different disorders, different problem levels. Being able to coordinate and collaborate across those things, it ends up being an obstacle. So figuring out how to manage all those things.
Yeah, just to add to what Kevin was saying, access to mental health care is, quite honestly, it's needed everywhere in rural Wisconsin and even in urban areas. And especially adolescent and psychiatric mental health care is a huge need everywhere. I would also like to remind everyone of the challenges of people with drug addiction, whether it's alcohol or opioid. These are big challenges, especially in rural Wisconsin and rural America. I took care of a young man who had relapsed, and he was now doing heroin. And he earnestly wanted to get off heroin. And my options at that time were really limited. I can only do so much in an ER, and you really want to have a seamless handoff to someone who can provide the extended care that these patients need and deserve. Suboxone is a wonderful drug that helps patients with opioid addiction. There's a thing called an X waiver. This is directed at Jodi and Jeff. I'd love to see the X waiver go away. You can look up X waiver on your own, but it just gives people like myself the ability to prescribe Suboxone on a limited period to get them to the place they need. I am optimistic about telemedicine. One of the benefits of COVID and the pandemic, we've really seen telemedicine expand. I believe in the budget, there's expansion of child psychiatric care, and telemedicine is going to be a big part of it. The other thing I will remind everyone, and this has been touched upon by most of us, is that just the cost of prescriptions. I'm tremendously happy to hear that insulin, making it more cost effective. If one of my great frustrations is seeing patients come in to the ER tremendously ill with DKA, diabetic ketoacidosis, so their blood sugars are through the roof, they're tremendously ill, all because they can't afford insulin. So this, you can extrapolate this to other things like high blood pressure, heart disease, anyway. So these are some of our frustrations for frontline healthcare workers, and the budget is really helping move, give us the resources we need to care for patients. So thank you for listening to my rambling.
Thank you. Yeah, and I think both of you touched on a lot of key points as to, especially when you talk about children and mental health, these resources that the governor has put in the budget is really a way to stop the school to prison pipeline that we're often seeing in marginalized communities and in rural communities and stuff, because it's targeting the issues straight on. And that's not just like and then even having expanded BadgerCare access can help families, and it's all just one encompassing thing. Jeff and Jodi, if you want to follow up with these needs and about how parts of the budget proposal will take on these challenges, that would be great.
Well, first of all, I want to
I will jump in front of Jodi, because otherwise I won't get a chance to speak. We always talk, no, I'm just kidding you. Just kidding you, Jodi. Wait,
just go fishing off your dock, still? Jeff, come on.
Okay. Well, I thought you were going to tell me to jump off my dock, Jodi. All right, so if it were real, I just wanted to say, from our standpoint, the budget is a moral document, and there's nothing that demonstrates that more than the section on healthcare. It is a moral document. It tells everyone who we are, what we value, and when Chris, when you mentioned just the section on limiting the cost of insulin, that one piece, we're going after the greed that has driven the big pharma to kill people, to put people in a terrible position of choosing their meds over their food, over their rent, over their other necessities. And so we need to go after that greed. And when I mentioned that, I'm just going to also mention the fact that right now we have, because we are a gerrymandered state, it is, because I don't like to lump everybody into being mean or evil or any, but there are certain people who are leading this majority party who I would put in that category, because their morals are missing when they actually keep turning away billions of dollars that is our tax dollars that should be coming here, ensuring that 92,000 people get the affordable health care that they need to be able to provide the other pieces that are in this budget. That's just plain mean and evil. It's wrong. And they demonstrated once again this past week, to tell you the truth, what kind of people we're dealing with. When they went after and challenged the governor's emergency order for the pandemic and took it to the Supreme Court, who then ruled in their favor, they have now taken $49 million a month away from people who need it for just affording food. It's $49 million for families to provide food on their table. And this is the sort of leadership we're getting in this state. And I'm sorry if that's a little off topic. I don't really think it is. I think it's reality. And we have to face that reality, and we have to fight hard to be able to get health care for people in this document. And we have to fight hard in every aspect. And I'm asking every citizen out there to show up at hearings and show up in every way they can and fashion they can, because this is our moral document that tells the world who we are and what Wisconsin stands for.
Yeah. And for those of you guys who don't know, Jeff and I like to give each other a hard time. I say that Jeff is like my much older brother that I like to pick on a lot. So when I tell him to go fishing off of his dock, it's done in love, really, truly. So, but yeah, it's so frustrating to talk to some of my colleagues who say, well, we already have Medicaid and BadgerCare for those who are under the poverty line, and that's good enough. Well, when we're talking about expanding Medicaid, we're talking about bringing affordable insurance to people who are barely above the poverty line. And I figured it out for our last budget, and it was somebody who was working as a full-time certified nursing assistant and having their partner working as minimum wage for 35 hours a week is the amount of money that they'd be bringing in and still be eligible for this expanded BadgerCare. So we're not talking about people who are making a lot of money. We're talking about people who are really struggling to put a roof over their head. And if you've never been sent to collections for a medical bill, if you've never had to choose between I need to go to the doctor or I need to pay my rent, because for somebody in that situation, $1,000 copay is like having $100,000 copay. It's just, or excuse me, deductible. It's just out of the realm of something that you can do. And we need to not have to have people make those choices. That's the sad thing. And when we look at who needs, treatment, substance abuse treatment or counseling, things like that, oftentimes some of the biggest users of those services are people who are on BadgerCare. And so do we want to treat this at an earlier level and sooner in the process, or do we want to wait until it gets out of control? And, it's such a big deal that life-changing incidences have happened. And when we look at mental health care, we need to really tackle this problem. This is blowing up all over our country, all over our state, every single corner, every single county. And we need to not look at just expanding beds, not just having more beds available for patients who are, have been chaptered. We need to see how can we get more providers in our area? How can we get more people who are going to work to keep these people out of a crisis situation? And so I really do believe that we're at this point in our state budget where we can really make some big changes and completely make a difference in a generation of people. And like Jeff said, it's a moral document. So what kind of decisions are we going to make? Are we going to make decisions that change people's lives? Or are we going to answer to big dollar donors?
Perfect, thank you. So I guess the next question would be, again, to probably Jeff and Jodi, but Chris and Kevin, you can answer it as well. What would the $1.6 billion in new federal money for BadgerCare expansion mean for the people of Western Wisconsin? So yeah, what could we do with that money here in Western Wisconsin that we don't have now and that we're pretty much being starved from just because of partisanship? So whoever wants to take the floor can.
Sure. I can just tell you, if I'm reading it right in front of me here. This just saving the $634 million over the biennium would allow us to expand BadgerCare and affordable health care again to 90,000 uninsured and underinsured Wisconsinites. That's in Wisconsin. I can't tell you what the numbers are specifically for Western Wisconsin, but it increases the financial stability for low-income families. When we're talking currently, what BadgerCare is at 100% poverty rate, and the poverty rate, by the way, is a formula determined at a federal level. That 100% poverty rate means about $6.10 an hour job. Nobody can live on that, right? Even raising it to the 130% that we're asking to do, and with the BadgerCare expansion, that means people who make about $9 an hour. They are still working for poverty wages. We're not asking for the world here. And the other thing that I like to remind people, 138% is what it is. By the way, this is not a giveaway. That's the other thing I think is a misconception. BadgerCare is not a giveaway. It just is an affordable plan that is offered to people of low income. So I think those are important points to keep reminding people of. We're not giving something away. We're asking people that need healthcare, that are offering people who need healthcare something they can afford, rather than just handing something to them.
I mean, it comes down to a lot of money per county. I mean, $1 billion, $1.6 billion, and it's money that we're leaving on the table. This is money we're paying in to the federal government and we're not getting back. And so this money is going somewhere. It can go to Montana, it can go to New York, it can go to Florida, or it can come back to us, the taxpayers. If we put it on a more local level, from our Wisconsin taxes, we pay in to the state, and the state sends it all to the school districts. And then we also have a local part for our school district that we pay as well. It would be completely irresponsible for any school district to say, no, we don't want to owe Madison. We just want to fund our schools by ourselves. A school district would be nuts to do that. And everybody on that school board would be voted out the very next election, if not recalled immediately. But over and over and over again, this is what's happening down in Madison. We're saying, we don't want the money that we've paid into the federal government. We want you guys to just keep it or send it to someplace else. So this is a huge deal. We're talking, Jeff mentioned earlier about the added SNAP benefits that we're missing out on by this executive order being canceled for the emergency, being $50 million a month, 1.6 billion over 2 years. It's so fiscally irresponsible that we're leaving this on the table, that this is something that we just need to take a stand on. I mean, I can't fathom that people who claim to be fiscal conservatives would leave this there. I mean, this is a game changer for local governments, for local health departments, for individual programs and individual people, the lives that we change with $1.6 billion in this state for accepting a federal Medicaid program. It blows my mind that this is what Robin Voss is calling a non-starter, that we can't even have this discussion. It's completely irresponsible. And that's the cleanest way I can say it.
I'd like to throw this, yeah, I'd like to throw something. Chris, you're going to talk anyway, but I'm going to start you off by asking you your take on this and keeping rural hospitals open, because we're at a crisis level right there.
Right, and that's what I was going to say. This is an investment. It's an investment in our communities, our rural hospitals, our clinics, and it's an investment in our neighbors and the people of our communities. And let me sound like a Republican for one moment. When we invest in something, we expect a return on our investment, okay? And we expect everyone to be productive and go out and live their best life. And I will also remind all of us that when we don't invest, and we don't invest in healthcare, and we don't give people healthcare, it's really a huge cost, because they come in to see me on death's doorstep when most of this could be prevented. And so it's much more cost effective to give people the healthcare they need and deserve. We all need it. I need it, my children need it, you need it, your children need it, everyone needs it. So this is just a common sense thing to expand BadgerCare and to provide healthcare to as many Wisconsinites as we can.
Thank you. Yeah, and this is actually going to really expand on what you're just saying, Chris, but so especially in regards to preventative care, mental health care, how could the Prescription Drug Affordability Board and office actually help your patients? We have an outrageous issue with prescription drug prices as it is. How could this board and this transparency that the government would have with prescription drug companies be beneficial to your clients, both Kevin and Chris, to prevent future issues?
Yeah, for the most part, emergency medicine is pretty simple, and we use medications that are for, pretty cost effective. However, I will say it's always helpful to know what is the most cost-effective medication I can give a patient based on what insurance they have. And again, as we've stated, all these critically important medications like insulin, blood pressure medication, chemotherapy, all the mental health medications, and things like Suboxone, they really need to be cost effective. And no one needs to go bankrupt on their medications, as Jodi already touched on. You don't need to make these impossible decisions. Do I want electricity, or do I want my blood sugar to be well maintained? So again, healthcare is tremendously important, and the budget is moving healthcare in a positive direction.
Awesome, thank you. And Kevin, I'm sure mental health prescriptions are not that affordable, so.
Right. So yeah, there can be a wide range, and I think I'm a psychologist. I don't prescribe medications, but we work with those things, and medications can often be helpful. And the thing what I really liked about the proposals is many steps between no service or help and the steps towards complete care at the end of life, all the things that go in between. And as those steps like crisis or collaboration between law enforcement and mental health, all those things that are steps in between that can be helpful. One thing about COVID is we saw that when you have kind of this overall extra stress, you saw the breakthrough ramifications of that. And so whether those stresses related to COVID, kids not going to school, medication costs, or anything like that, when the system is comprehensive and built thoughtfully, I think that makes what we do easier and better.
Absolutely, thank you. I'm just going to ask one more question, and then I see that Jacqueline also asked a question. So the next question from me will be about the caregiver shortage, and what are your thoughts on the tax credit for family caregivers would help with your constituents? So this is for Jeff and Jodi. And what do you think about the increased funding for care worker wages?
I'm jumping in first on this one because the best thing that I can say is, woohoo! I mean, I think if 2020 taught us anything, it's that care workers, whether it's people who are at home caring for their own kids, their own parents, or paid care workers, we can't do anything without having people taken care of. And so for sure, the wage increases that are coming in this budget with that, but also just, again, the respect, knowing that we need childcare workers, we need people who are going to take care of our aging parents, and we need to treat these people with the dignity and respect, and I mean the employees that they deserve, so that they can treat our loved ones with the dignity and care that they deserve. Is critical. I mean, again, a budget is a moral document, and who do we want to take care of? 2020 has taught us that we need to make sure that we're taking care of everybody, because we can't go to work out in the, outside of our four walls of our home if we've got kids at home that aren't being taken care of, if we've got aging parents and ailing parents that aren't being taken care of. And so unless we can get care workers for that, and sometimes to do that, we're going to have to pay more. When we're hearing over and over again, well, I can make more money at Quick Trip than I can doing this job that I'm called to do, that I love doing, it breaks my heart, because, we need to be able to do that to make sure that we've got workers out in all fields. So this is something important, and this is where some of that 1.6 billion that we're going to bring in from accepting the federal Medicaid expansion, this is where some of that money could go to. So.
Jeff, do you want to go? Oh, he's out. Hey, Chris, do you want to go?
I would love to. Yeah, this is a reimbursement issue, right? No one wants to do a job that you don't get paid well. It's that simple. And so we, as a society, as a state, need to say this is worth more than $8 an hour. And so if you want mental health workers, actually, from a medical doctor, the high reimbursement specialties are surgery, orthopedic surgery, neurosurgery, et cetera. And, the lower paying are pediatrics, psychiatry. So we just need to reimburse it, and people, that will help tremendously.
You're muted, Brianna.
There, and I think Jeff is back. Are you back, Jeff?
I'm back.
Okay.
I'm back. We need broadband expansion. That's not what we're talking about today. But on the long-term care, and I'm sorry, I didn't miss the end of what Jodi was saying or what Chris said, but I'll give you some numbers, because if that's the question here, $600 million investment in this budget just for the long-term care infrastructure, which includes an 11.5% increase to nursing home rates for fiscal year 22, and 11.7% increase in fiscal year 23. That's $240 million. That's to pay people what they deserve to be paid. I don't want to ever forget after this year what essential worker means. That's something we need to repeat over and over when this is done, that people are essential at what they do. We can't do what we need to do without them, and especially when it comes to the frontline health workers. This also creates a pilot software platform, so it allows a one-stop shop for everyone in caregiving industry to find another matched service provider. Finally, it offers additional funding to support the Office of Caregiver Quality, which helps to ensure Wisconsinites are going to get the highest quality caregiving services. So this budget really does aim at that long-term care piece, because by the way, people like me, we're going to be causing that part of our healthcare industry to bulge very soon. So we're going to need to be investing in it and make sure we have the caregivers there for when we need it.
Perfect. Thank you. So that's all the questions I have. We will take it to, we have a few attendees on Zoom. Like I said, if you have any questions, you can put them either in the Q&A or the chat. Jacqueline did ask, how do we assure that there will be enough providers for mental health care and MHC beds available with quality treatment when needed?
I can jump in on that right away too, because I have it in front of me as well. And Jackie, I appreciate that question, and I know this is actually a very controversial issue, and that we have differing opinions with maybe some of our colleagues on the other side of how to approach this. But the governor takes this approach. He's going to fund a multiple region crisis center that would provide crisis urgent care and funding to multiple regional crisis stabilization facilities. It also increases the funding for crisis intervention and a training grant program, and it funds additional staff for county and peer-run respite center crisis phone lines, which we need. Let's not, and Jodi mentioned this earlier, let's not have the situation where we're automatically putting our police officers in a place where, what are they trained to do? They're trained to arrest people and bring them down to jail and deal with it there. Let's take care of it before it gets to that point. It also funds a support emergency response collaboration grant, which would provide a simultaneous response to 911 calls. And finally, there's a behavioral health bed tracker to provide real-time inpatient peer respite and crisis stabilization capacity and bed availability to reduce the logistical challenges and improve the medical clearance process. And we're here, I know in my district, I'm hearing it, and I just had a meeting with sheriffs yesterday in my district, because this is a really big issue with them throughout Western Wisconsin for it is a logistical nightmare to transport a patient from the jail down to Winnebago, for instance.
And I think we need to keep with, as we're looking at that, like, how can we keep people out of that crisis piece to begin with? And what lessons have we learned in 2020 that can help us with that? Whether it's making sure that we've got broadband in all corners of the state, and that's, you know, the urban areas as well as the rural areas, so that when somebody is having a problem, they don't have to worry about driving an hour and a half to somebody who's in network. They can do a video call with them. And how can we increase that telemedicine acceptability with insurance companies, and just also a stigma piece? Like, you know, if I needed to talk to Kevin and I'm in a crisis, it might be easier for me to just sit here in front of my computer like I'm doing right now and have this conversation, versus leaving my house and going to a clinic that I don't know and having anxiety, you know, build up, things like that. That's a really important piece. So what can we learn from 2020 and take forward to help people be in a better position to begin with? What can we do to stop mental health crises from getting to that point? We need to do everything we can to make sure that we've got a great state to live in, so that counselors and psychologists want to move here to begin with. We need more providers. How can we help that out? What can we do, maybe even, you know, at a college level, to making sure that we're increasing those programs throughout the state as well. Not to mention internships and fellowships around the state, because usually where you start your career is where you're going to maybe set up your family as well. And so how can we do that? There's so many ways that we can look at this, and some of them get touched on in the budget, but there's a lot of other ways that we need to fight this problem, and it's absolutely a multi-pronged approach, and we need to keep that in mind. And it's going to be a long road. It's going to take us a while to get to getting the resources set up to do it. But I'll let Kevin jump in, because I'm sure he's got 1,000 ideas, and I'd love to hear them.
Well, I was just going to say, let me jump in before Kevin. I was just going to say, number one, let's prioritize mental health. We have to take the stigma away. We have to remind everyone that these are real healthcare issues that can be as debilitating as a heart attack, as a stroke, as diabetes, as kidney failure. This is a real issue. And by prioritizing it as a society, as a state, and by funding it that way, really it does, as I already said, it comes down to funding and reimbursement, and by making it a priority, we give it the resources that mental health needs on all the ways that both Jodi and Jeff have been stating, that make it a comprehensive net of care for the people of this state. And if 2020 didn't stress you out, and I don't know what you were doing, but I want to know, because I was super stressed in 2020. So what I'm trying to state is simply that if you haven't had your mental health crisis, it's going to happen.
Yeah,
Thanks for the warning, Chris.
yeah, it's true. I appreciate a lot what everyone said, and it's been such a year. And I think the stuff about telehealth it's been so helpful in a lot of ways to help with access in a crisis. We had a lot of us have done telehealth where we can't do face-to-face contact, or so it's really shown us some of the benefits of expanding technology, extending our reach, trying to be smart and comfortable about it. And I think the things that you were talking about, Jodi, are right on. I think by being thoughtful vanguards and thinking about ways to enhance the structure of what we do, and moving in smart ways, smart, thoughtful ways that are caring, that is compelling. And I think when that stuff is seen, then smart people will want to participate.
Just to follow up on a couple of Chris's comments, when we're talking about prioritizing, just want to put the plug in for everybody to make sure that we're always checking in on everybody else, your loved ones, your neighbors. If you've got somebody in your life that has had problems with mental health, reach out to them on an occasional basis and just ask how they're doing. Just like if you had somebody in your life who was undergoing cancer treatment, occasionally you would reach out and just say, how are you doing? Can I bring a meal over? We need to all of us, every single one of us, take the stigma out of this. And then just the sassy part of me, Chris, when you were saying if 2020 didn't stress you, I don't know what you're doing, makes me think about some people who are living in states where they've legalized marijuana, which is another piece of the budget that we haven't even touched on. So.
Perfect. Thank you so much. I don't see any other questions, and I don't have any questions. So if